What should your blood pressure be according to your age? Regulating your blood pressure can become a real virtue, unless you are older and unable to do so. In that case, this is pretty harmful and sometimes impossible. This was shown in a study that involved 2,000 seniors. The results were published online in the Archives of Internal Medicine and they actually surprised the world. When it comes to high blood pressure, there is no place for mistakes. Hypertension is a real-life threat. It affects the function of your arteries, kidneys, and your body in general. This causes heart attack, heart failure, stroke, kidney failure, and other dangerous health issues. This is the reason why most doctors reach for aggressive therapies when it comes to treating hypertension. Same as other health conditions, a particular method cannot be applied to everyone. There are different treatments for 50-year-old men and 80-year-old men, as the therapy of the first group does not correspond to the individuals in the second. How is hypertension diagnosed? Healthcare providers require an exact picture of patients' blood pressure and note how things develop over time. The whole process starts at the age of 20. The American Heart Association recommends young people to screen their blood pressure at their regular healthcare visit, which is once in every 2 years. This applies to those whose blood pressure is lower than 1/120th of a millimeter Hg. Blood pressure rises with your heartbeats and drops when the heart relaxes between the beats. Blood pressure varies every minute according to the posture, physical activity, stress, and sleep. Normal blood pressure for adults at the age of 20 and over is less than 1/120th of a millimeter Hg, which is less than 120 systolic and less than 80 diastolic. Unfortunately, 1 in 3 adults in the U.S. suffers from blood pressure. When patients' blood pressure is higher than the normal values, doctors make more readings over time. In some cases the patient is advised to monitor the blood pressure at home, before being diagnosed with high blood pressure. A single peak does mean you are dealing with high blood pressure. But, if your blood pressure maintains values of 140/90th of a millimeter Hg or higher, which is systolic 140 or more and diastolic 90 or more, your doctor will require that you start off a treatment program. These programs involves lifestyle and dietary changes, and even prescription drugs for individuals with blood pressure that is higher than 140/90. If your systolic value is 180 mm Hg or more and your diastolic value is 110 mm Hg or more, rest for several minutes and monitor your blood pressure again. If it is still that high, make sure you seek for medical help immediately, or require an emergency treatment for your hypertensive crisis. If you are unable to get help and reach for the emergency medical services, EMS, ask someone to take you to the hospital. If your blood pressure is normal, it does not mean that you have to still. Introduce some lifestyle changes to protect your health and prevent your blood pressure from going up. This will also help you improve your overall health. How'd you get so far away?